Here's something almost nobody questions. When your eyesight starts slipping, you book an eye exam, read a few letters off a chart, and walk out with a stronger prescription. That's the entire treatment plan. A better lens to cover for a weaker eye. Nobody ever asks the obvious question. Can the eye itself be trained back into shape? Because here's the truth, nobody tells you. Your eyes are wrapped in real, physical muscles. Trainable muscles. Muscles that atrophy from neglect just like any other muscle in your body. And in most adults, those muscles are running at a tiny fraction of their true capacity. Nobody mentions this because a new pair of glasses is a recurring sale, and a 3-minute daily routine is not. I'm going to break this down for you anyway, so if that sounds useful, stick around till the end, because this gets very specific very fast. Let's start with what's actually happening inside your eye socket, because once you understand the mechanics, the exercises stop feeling random and start making complete sense. Each eye is controlled by 6 external muscles, literally called muscles outside the eyeball. These are the muscles physically responsible for every movement your eye makes. Side to side, up, down, and rotational tilt. 2 of them, working as a pair, pull your eye inward toward your nose and outward away from it. That's your entire horizontal range. Another pair handles vertical movement, pulling the eye up and down, each with a slight rotational twist built into the motion because of how they're anchored. Then there are 2 more muscles dedicated, almost entirely to rotational stabilization, the kind of micro adjustment that keeps your vision level when you tilt your head. All 6 fire together, in constant coordination, every single time your gaze shifts. Not one of them is optional. Remove one from the system, and the whole mechanism breaks down. But here's what almost nobody, including plenty of professionals, fully appreciates. Those 6 outer muscles are only part of the picture. Inside the eye itself sits another muscle responsible for reshaping your lens on demand, letting you shift focus from something close to something far away and back again in a fraction of a second. And beyond that, you've got 2 more tiny muscles controlling how your pupil opens and closes in response to light. Add it all up, and you're looking at a minimum of 8 distinct muscles per eye. 16 total, working across both eyes. 16 muscles that respond to training. 16 muscles that deteriorate from disuse. And 16 muscles that the overwhelming majority of people never intentionally exercise a single day in their lives. Sit with that number for a second. 16. If someone told you they were getting into shape, but only planned to train 2 out of 16 major muscle groups in their body, you'd think they'd lost the plot. Yet that's essentially what modern life does to your eyes. Screens, phones, dashboards. Everything demands tight, close-range focus, and almost nothing demands the full range of motion those muscles were built for. The muscles responsible for peripheral tracking, wide-angle coordination, and rapid long-distance focus shifts spend most of their existence sitting almost completely idle. Before I hand you the actual exercises, I need to dismantle a claim you've probably heard 100 times in ads. Do this one move and your vision transforms. I want you to understand exactly why that's physiologically nonsense, and what an approach that actually respects how your eyes work looks like instead. That's coming right up. Picture someone telling you that training a single finger will turn you into a concert pianist. Absurd, right? A piano demands 10 fingers moving in precise coordination. Your visual system demands 16 muscles doing the same. A single exercise targeting a single plane of movement cannot produce full visual improvement any more than isolating one finger can produce musical mastery. What actually works is a complete, layered approach, one that hits the outer eye muscles, the internal focusing muscle, and the surrounding tissue, all together. That's exactly what I'm handing you now. Exercise 1. I call it the wipers. And the story behind it matters, because it explains exactly why it works. Years ago, early in my career, I spent time at serious elevation, somewhere between 13,000 and 16,000 feet. I was young, overconfident, and skipped proper UV protective sunglasses. Real mistake, and I paid for it. Here's something most people don't realize. UV intensity doesn't stay flat as altitude increases. It climbs sharply. Past roughly 8,000 to 10,000 feet, the atmosphere thins out, filtration drops, and the radiation hitting your eyes intensifies dramatically. Enough, in fact, to cause real photochemical damage to the retina, the light-sensing layer at the back of your eye. I came down from that trip with a noticeable, measurable drop in my vision. Not catastrophic, but undeniable. And instead of just accepting a new prescription, I started experimenting. This exercise was the one that produced the fastest, most obvious improvement. Here's exactly how to do it. Without moving your head, turn your eyes as far right as they'll physically go. Full lateral extension, right to the edge of your range. Now, from that extreme position, sweep your gaze slowly and deliberately in a wide horizontal arc, all the way to the far left, then back to the far right. Slow, controlled, not a quick flick. You should feel a genuine pull or stretch in the muscle on the opposite side of whichever direction you're moving toward. I named it the wipers because the parallel is exact. The way a windshield wiper clears smearing and grime off the glass and restores a sharp, clean view of the road. That's precisely what this movement does for your visual field. Most people notice the difference within 1 or 2 repetitions. The first time people try this, the common reaction is discomfort, sometimes real pain, at the far edges of the movement. I want to explain why, because people assume it means something's wrong. It doesn't. It's a lifestyle diagnosis. Think about how your eyes actually move in an average day. Phone, laptop, TV. Maybe a glance across a room. In every one of these, your eye muscles operate inside a tiny sliver of their total range. By some estimates, only 10 to 15% of what's physically available. Day after day, year after year, everything outside that narrow zone gets almost zero demand. And like any muscle under chronic disuse, it shortens, stiffens, and loses elasticity. The connective tissue around it tightens up. When you push your eye to its true extreme, the muscle that has to stretch to allow that motion pulls against all that built-up stiffness, and you feel it instantly. But this isn't just about comfort. There's a real mechanical consequence to chronically tight eye muscles, and it's the reason this simple exercise carries actual clinical weight, which is exactly where we're headed next. Here's the part most people never connect. Chronically tight, rigid eye muscles don't just feel uncomfortable. They physically compress the eyeball. Your eye isn't a rigid, unyielding structure. It has walls, internal fluid, and it responds to outside pressure. When the muscles surrounding it stay locked in a state of chronic tension, they squeeze the globe. That squeezing affects the tiny blood vessels feeding the retina. And the retina is neural tissue, essentially an extension of your brain sitting inside your eye. Neural tissue is some of the most metabolically demanding tissue in your entire body, and it is extremely sensitive to even a modest drop in blood supply. Cut that supply down, even slightly, and visual sharpness declines. So when you do the wipers and feel that stretch at the extremes, you're not just loosening a tight muscle for comfort's sake. You're actively relieving mechanical pressure on the eyeball, restoring blood flow to the retina, and improving the oxygen and nutrient delivery to the exact tissue responsible for how clearly you see. Stick with this daily, and here's roughly what to expect. Within the first week, discomfort at the extreme edges of movement starts easing off. By 2 to 3 weeks, it's usually gone entirely. That disappearance is a reliable signal. It means the muscles around your eye have returned to a healthy, functional resting state instead of sitting chronically shortened. Once you hit that baseline, maintaining it takes almost nothing, just a few minutes a day. Exercise 2, vibrational massage of the eyeball. Before the technique, you need the reasoning, because this is what separates it from something random. In manual therapy, there are 4 core techniques: gliding surface strokes, deep localized friction, rhythmic compression, and vibration. Of these 4, vibration is uniquely able to send mechanical energy deep into tissue. It travels as a wave, moving through the full thickness of a structure rather than just skimming the surface. That's well documented in manual therapy, and it's exactly why vibration is used when the target tissue sits deep beneath the surface. Now apply that to the eye. Your eyeball is roughly the size of a ping pong ball. Inside, there's a gel-like substance holding its shape, 3 layered walls, a tough outer coat, a densely blood vessel-rich middle layer, and the light-sensing retina on the inside, plus the optic nerve entering from behind, all wrapped in surrounding muscle, fat, and a fibrous outer capsule. If you want to improve circulation through that middle vascular layer, ease tension in the connective tissue, and normalize the internal fluid movement, all at once. Surface pressure won't cut it. Direct forceful pressure on the eye is actually something to avoid, since it can spike internal eye pressure, and in some people, that's genuinely risky. Gentle vibration, on the other hand, is the right tool. It stimulates microcirculation, encourages fluid exchange in the tissue, and gently loosens surrounding connective tissue. without any of the pressure risk. Here's exactly how to do it. And this next part matters for safety. Where you place your fingers, how much pressure you use, and how long you hold it. Coming up right now. Place one finger at the inner corner of your eye, right where your upper and lower eyelid meet near your nose. There's solid bone right underneath there for support. Place a second finger at the outer corner of your eye, where you again have solid bone to rest against. This matters. Both fingers should rest mainly on that bony rim, not directly on soft tissue, so you never accidentally push sideways pressure onto the eyeball itself. Now, using the soft pad of your fingertip, the sensitive part just below the nail, make the lightest possible contact with your closed eyelid, not a press, barely the weight of your finger landing. From there, start a fine, rapid vibration, small movement, fast rhythm. Hold it for 20 to 40 seconds without adding pressure. Then slowly lift your fingers away, pause 5 seconds, and open your eyes. Most people notice an immediate shift in clarity. Colors can look slightly more vivid. Detail, near or far, often sharpens. This isn't imagination, and it isn't placebo. It's improved blood flow in the eye's vascular layer, relaxed surrounding muscle, and normalized internal fluid movement, all inside under a minute. Let me tell you something that's stuck with me over 15 years of practice. I've come across a small handful of patients, over 70, who wore 0 corrective lenses, no reading glasses, no distance glasses, nothing. Clear, functional vision deep into their 80s. That's genuinely rare. Age-related decline in the lens, retina, and focusing muscle is basically universal, expected, documented, near guaranteed in most Western populations. So what set these people apart? Every single one of them, when I asked, described doing some form of eye exercise daily, for years, treated as non-negotiable, the same category as brushing your teeth. Not a chore, a genuine, disciplined habit. There was one more thing they all shared, and it's worth mentioning every time this comes up. They were sharp. Mentally quick, clear in conversation, sharp recall. Now, I want to be careful. This is an observation from practice, not a controlled study. But there's a real physiological basis for a link between visual training and cognitive function. The part of your brain that processes vision takes up roughly 30% of your entire cortex, the single largest sensory processing region you have. Regular, complex visual training, full range movement, dynamic focus shifts, coordination demands, generates sustained activity in that region. Whether that activity helps preserve mental sharpness, or whether sharp people are simply more likely to stick with disciplined habits in the first place, is genuinely hard to untangle. Most likely both are true and reinforce each other. But after seeing this pattern repeat enough times, I no longer chalk it up to coincidence. Now for the third exercise. And this one is the most relevant if you've noticed yourself holding your phone or a menu farther and farther from your face just to read it clearly. That farther and farther away problem has a name: presbyopia, the clinical term for age-related loss of near vision. It typically starts showing up in your early to mid-40s, and it affects nearly everyone in Western populations who lives long enough. It's almost always managed the same way: reading glasses, progressive lenses, bifocals. The standard explanation is that the lens hardens with age and loses flexibility, making close-up focus harder. That part's true. But here's what rarely gets mentioned. The internal focusing muscle responsible for reshaping that lens actually keeps working fine. Research shows that even in people with presbyopia, this muscle keeps contracting normally in response to focusing effort. It's the lens that stops responding, not the muscle that stops firing. Which means the muscle itself can still be trained and maintained, and doing so consistently, especially if you start early, may genuinely slow the functional decline. The standard recommendation for training this muscle is the classic near-far focus drill. Hold your finger close until it blurs. Pull it back until it's sharp. Repeat. It works, but it only loads the muscle along one straight line directly in front of your face. Here's a more effective version. Bring your finger toward your face until the image starts to soften. You're approaching your close focus limit. Hold it there. Now, instead of just pulling straight back and forth, start moving it in a slow circle, up to one side, down to the opposite side, while trying to keep it as sharp as possible the whole way through. The focusing muscle now has to work, not just to hold near focus, but to actively adjust that focus as the target keeps shifting position in space. Reverse the direction. Then start varying the distance mid-circle too, closer through one part of the arc, farther through another. What you end up with is a multi-directional, constantly varying load on that muscle, a training stimulus that's simply more demanding and more effective than a straight line ever could be. The real challenge with any of these exercises isn't learning them, it's actually doing them every day. The fix that's worked best, both for me personally and with patients, is anchor linking, attaching the new habit to something you already do automatically. I do my focusing drill in the elevator every time using the overhead light as my visual target for the ride. No extra time, no willpower required, no reminders. The elevator itself is the trigger. Your anchor might be your morning coffee, your computer booting up, waiting at a red light. Doesn't matter what it is, as long as it happens daily without fail. Because 3 minutes done consistently every day for 6 months will outperform a 45-minute session done once a week, every time. Consistency is the whole game, especially compared to the alternative, a stronger prescription every 18 months, and a growing, permanent dependency on glasses you have to carry, clean, and constantly replace. But exercise alone isn't the full picture. There's a nutritional piece almost everyone chasing better vision completely ignores, and skipping it seriously caps your results. That's exactly where we're headed next. Exercise is a stimulus. Whether your body can actually respond to that stimulus, repair tissue, adapt, improve function, depends entirely on the raw materials available to do the job. Training a muscle that's being fed by a nutritionally depleted system gets you a fraction of the possible result. It's like trying to build a house while the supply truck keeps showing up half empty. Progressive nearsightedness, vision that keeps getting worse over time, is almost always tied to specific nutritional gaps. The single biggest and most common one, especially in northern climates, is vitamin D. This isn't a minor issue. Vitamin D plays a direct, documented role in how your retina's light-detecting cells function. It's linked in research to your risk of age-related macular degeneration, the leading cause of permanent central vision loss after 50, and it's increasingly tied to how fast nearsightedness progresses in kids and young adults. If you're doing all the right exercises, but your vitamin D is on the floor, you're working against yourself. Get it tested. It's a simple blood draw, and correct it if it's low, which in a lot of northern climate populations means most people. Your age tells you exactly how urgent this is. The focusing muscle starts showing measurable decline in your late 30s. Most people notice it clinically by their mid-40s. By 50, risk factors for macular degeneration climb sharply. Past 60, uncorrected vitamin D deficiency compounds retinal aging even faster. So the honest answer to when should I start is always the same: now. And the earlier, the better. There's one more angle worth mentioning, and it comes from an old observation that turns out to hold up under modern scrutiny. Traditional medicine has long linked eye health to liver health. It sounds like folklore until you remember that one of the clearest early signs of serious liver trouble, jaundice, shows up first as yellowing in the whites of the eyes, often before it's visible anywhere else. That's not ancient mysticism. That's a standard finding taught in modern medical training. So what actually strains your liver the most? Two things, mainly. Heavily fried and smoked food generates compounds that are directly toxic to liver cells, forcing your liver to spend its capacity, neutralizing them instead of doing everything else it's supposed to do. And heavily processed meats, packed with preservatives, synthetic colorants, and flavor additives that serve zero nutritional purpose, add to that same burden. The cleaner your food, the less your liver has to fight through just to keep up. There's also a less discussed factor. Chronic anger and sustained stress aren't just emotional states. They're real physiological stressors, tied to elevated stress hormones that drive inflammation and impair liver function over time. Interestingly, several languages have old expressions linking a bitter, irritable temperament directly to the word for bile, a connection people noticed long before the biochemistry behind it was understood. For direct liver support, milk thistle has one of the strongest evidence bases of any natural compound in this space. It helps stabilize liver cell membranes, supports cellular repair, and acts as a strong antioxidant against the toxic load your liver processes daily. So here's your complete routine. The wipers for your outer eye muscles, gentle vibrational massage for deep circulation, and circular focus training for your internal lens muscle. 3 to 5 minutes a day total, anchored to something you already do daily. Alongside that, cut back on fried, smoked, and processed food, check your vitamin D, and consider liver support like milk thistle. Your vision is not a fixed, declining number you're powerless to influence. It's trainable, and now you know exactly how. If this was useful, hit like, subscribe, and drop your age in the comments so I know exactly what to cover next for where you're at. Let's get this channel to 1,000 subscribers together.